Welcome to Navigating Hope, your compass to health empowerment. I'm Dr. Jamie Hope, steering you through healthcare, overcoming overwhelm, personal goals, and emergencies. We'll navigate the healthcare maze with actionable insights and real-world advice, unlocking the secrets to a healthier, more vibrant life. Join us to take control of your well-being and make informed decisions for your health and your future. Stay with us as we unravel the mysteries of medicine, wellness, and life's unforeseen challenges, helping you bypass the ER with a dose of knowledge. Stay tuned till the end of the episode with a recap of your actionable insights and a free gift. Let's chart a course to your well-being together. Hello, I am so excited to be here today with Dr. Leia Rispoli. She is a double board certified interventional pain management specialist and psychiatrist. She embraces an empathetic approach. Yeah, is that not right?
Yeah, physiatrist.
Physiatrist, that is very a little autocorrect. That's funny. Okay, physiatrist, and we'll talk about the difference, which are obviously very different, not just in spelling and pronunciation, but they're different specialties. So we'll bring that in. What we love about you, why we found you, and why we connected is because you embrace that empathetic approach with that ability to listen to your patients while delivering exceptional care. So to everyone who's listening, I want you to know she's employing innovative non-surgical interventions and evidence-based treatment and can restore a patient's function and quality of life by reducing or eliminating severe or prolonged pain. Wow, that is absolutely amazing. Dr. Rispoli's wide-ranging patient population typically includes those with chronic pain or acute pain of the low back, neck, head, peripheral joints, and pelvic region. She is highly capable of treating pain of any sort. She specializes in advanced neuromodulation, which is spinal cord stimulation techniques, pelvic pain, both male and female, ultrasound-guided interventional procedures, and regenerative medicine techniques such as platelet-rich plasma and stem cell therapy, which of course get a lot of buzz. So, Dr. Rispoli, the physiatrist, dual board certified. Now, this is amazing. Honestly, there are people who don't want to enter the chronic pain space. They look at it and see the downsides and the frustrations, and you're all in. Not only did you get one board certification, you got 2 board certifications to really help and serve these people who, and there's a huge need. So what was it that drew you to this in the first place?
Well, thank you for that lovely introduction. I appreciate you having me on your show today. Very honored to be here. And yeah, it's a good question. I think initially I went into physiatry as my initial specialty for residency because I liked the idea of treating athletes and musculoskeletal complaints and injuries. So I thought initially that I wanted to just do sports medicine, non-surgical medicine, be sideline doc. But what drew me to ultimately doing interventional pain and treating chronic pain patients for the most part was I think there was just a void in the field of providers really listen to patients and hear them. And there's so many patients that I see that just for the first time they feel listened to when they see me, even if they've been suffering for 20, 30 years. So it's rewarding in a sense to be able to just also be a listener. As a physician, I'm saying that doing maybe a little bit of therapy on top of treating their pain with interventions and other techniques to control symptoms, but there's a good connection you get with patients that find you trusting and feel you empathize and truly sympathize with them. So I like that part of the job, and it's not for everyone. So you really need to have a piece of you that it fits your personality and your soul a bit.
Yeah. No, that's really huge. And I think a lot of people who are tuning into this podcast just felt a breath of fresh air that maybe they're not used to. And they said, oh my gosh, there's a doctor who specializes in listening to me. Tell me about those kind of interactions when patients are telling you that you're the first person that listened. That's got to feel good and a little sad for the system.
Sure. Yeah. I think it's unfortunate in the healthcare system in our country, at least, the majority of providers are overwhelmed. They feel rushed. So patients feel that rush, that anxiety of being dismissed really quickly. If you're not within my scope of practice, I got to send you to somebody else, or I only have 10 minutes to spend with you. And I do feel those pressures of high volume. We're late a lot, maybe 15, 30 minutes on some days to see patients
Yep.
on their scheduled visit. But we really, when we're there, we try to be present. We try to really give patients our heartfelt time and really understand and get to know them. And I think it's received well. Like our staff, I have a mid-level. We have great office staff. Patients feel that from the beginning of their interaction with my office to the end. And that part is huge because when every patient comes calling because they're in pain. So
Yes.
some
Suffering.
patients are not pleasant at times, and we try to sympathize also with the fact that
Yeah.
they're calling because they're in pain. They need to be seen immediately. And if we have a booked a booked schedule, it's not always easy to squeeze every patient in. We see the burdens of the healthcare system being overwhelmed and all the issues that other providers face too. It's an ongoing problem, but we try to cope with it as best we can.
Yes. And I think it's a good reminder to patients. Typically, if we're running late, it's not because we're putting our feet up on the desk and having a good old time. We are spending that adequate time really listening to patients and occasionally taking a potty break. I have to admit, I'm a much better doctor when I don't have a full bladder.
Yeah.
So,
Yeah,
yeah.
you feel the anxiety, you got to go, or when you're fed. Like I can't give
Yes.
attention to patients if I haven't eaten a lunch or
Yes.
thinking about what I need to order for lunch because I'm so hungry. So yeah, it's self-care along with it helps you be a better provider.
It does. I've told my learners and my residents for years, I'm a better doctor with a full stomach and an empty bladder. That's my actual quote. And I love that you brought in that self care component because many of our listeners are serving a dual role as they're a caregiver for either their children, a family member with disability, or an elderly or ill loved one. And so that reminder that even you, a physician, a thought leader, somebody at the top of their game, is bringing that forth that you can do a better job if you fill your bucket first, because then you can pour into your patients more.
It's so important. I think especially women, and there's no offense to men, but women naturally want to take care of other people. It's in our
Yes.
genes. When we forget sometimes, especially as parents or caretakers of other loved ones, it's easy to neglect yourself first because you're worried about the well-being of somebody else that you're responsible for or you feel responsible for. But we all know it. It's the mantra of reminder, like needing to
Yeah.
take care of yourself to be able to be the better person to take care of other people. But it's good to remind yourself on a daily basis that should be a priority.
Yeah. So now to those listening, you have permission from not one, but two physicians saying self care isn't selfish and you can take better care of other people when you take care of yourself.
Exactly.
And so I think those practices allow you to bring forward that empathetic and active listening skills. So, how does that influence the success of your pain management techniques?
Think as soon as the patient walks through the door and feels taken care of in a pain management practice, they already feel a little better. They feel safe. They feel like they found a place that they can be open and hear sympathy from because that already is just sometimes unfortunately difficult to find in a provider's office. So
Yes.
I think that already implements a paved success. And then we try really hard to meet everyone's needs. It makes the practice somewhat stressful sometimes, but I think we set some boundaries with certain things. But I think for the most part, patients know they have access to me if they need me and to feel that to access me when it's appropriate, but they don't feel this disconnect with their doctor that they do in other specialties or other experiences where they can't reach their doctor if they're scared something's going to happen. A lot of my patients are just scared to continue to feel in pain or that their pain's a little better and they're really afraid to hit that place where they feel this hopeless, helpless pain flare again. And I think even just providing the security of knowing that you have me at an email if you really need me, you have my staff. We're always available if it's an emergency. So I think that type of just security blanket is a huge portion of our practice that we try to really consistently provide.
Nice. That's just such a lovely kind of wraparound service that because people do when they're in pain, you're physically suffering, it causes emotional suffering, and that fear, that sense of helplessness, it can be very overwhelming. So to have a physician who, as part of their prescription, brings empathy and brings listening and that wraparound service. That's why we connected because I see people on the worst day of their life in the ER all the time, and anything we can do to support upstream so they don't have to get to that level. And then even you said not all patients are always pleasant because they're suffering, and sometimes suffering does not bring out our most best coping skills. Yeah, you know exactly what I'm talking about. So, what suggestions do you have for patients so when they're at home, they're in pain, and they want to get to a service like yours, but of course there's always a little bit of time. What are some things that they can do quickly and immediately, and then to get on that journey?
Yeah, it's tough. A little bit case dependent, but in general, to really decide if their pain is so severe that it's appropriate for an outpatient practice. We're still an outpatient practice and we'll have some hurdles. We have to check your insurance that we accept it. We have to get you on the schedule amongst 50 other people that called that same day with a lot of severe pain. If you feel you cannot wait, the best option is the ER because that's where you'll get immediate care. We want to provide care to everyone we can, but obviously there's going to be some version of hurdles that we wish weren't there, but obviously that's what makes us an outpatient practice. We can only see so many people in one day. At the same time, when you call the office, we're understanding you're in pain and we'll do our best to get you in as soon as possible. So as long as everyone's on the same page about that, it tends to be a very seamless process. But for the most part, our patients, we love our patients. We have great interactions with them. I'd say pretty much we have it down to a good T where our first line of interaction with a patient that calls, make sure that it's an appropriate patient for our practice so that there's no frustration when they actually see me or talk to me that they had different expectations of what we can provide.
Nice. I love that. That it's very comforting when people know what to expect.
Yeah, and they're not frustrated when they have expectations that I have to give them disappointing news. We've really tried
Yes.
hard building the practice to make sure our office really explains thoroughly to patients what we do here.
Yes. So what I love about your practice is it's not a one size fits all approach. You're not just a single thing like every single patient must get PRP and that is all we do and it's the magic wand that cures everything. You look at the patient and then say, we have this kind of suite of potential things and then choose the right evidence-based option for the individual sitting in front of you.
Yes, and I think that's important because a lot of LA or Southern California, even major cities end up going to this out-of-network model where they really only provide cash-based things, and not every patient can afford that. So you really, it's, in my opinion, it feels good and empowering to be able to provide the whole gamut from options that are insurance covered, which is a factor, and I hate to say that, but insurance does make a difference. Patients pay into it, and some can't afford things that are outside of insurance.
Right?
And then we also offer things that are a little bit more cutting edge, newer, maybe not as recognized in the medical literature, but still have enough support to offer it to patients that in a safe way that may not be covered by insurance. So to be able to feel comfortable offering everything to meet the patient's needs in more ways than one is a good place to be in our practice.
No, that's excellent. I'd love it if you could walk us through. So a patient's coming in with pain. What are the various type of options that you can use to treat somebody?
So I guess the most common thing we probably see on a day-to-day basis is the neck and back pain. We see
Mhm.
that from people from ages 30 to 80.
As I correct my posture, I'm like, oh yeah,
Exactly.
okay, that's
Yeah.
right. Everybody, if you're listening to this, sit up straight, take a deep breath. Okay, there we go. All right, so continue neck and back pain. I see where it's coming from.
A good reminder. Yes. We all face it. That's because we have this
Yes.
posture that, we're upright species that tend to lose our good posture habits naturally from looking at our phones, looking at our computers, driving the daily functions that do our body a disservice. And a lot of us, and especially in Southern California area, are very active. So we have people that are like these incredible athletes into their 70s and 80s. It's impressive to me. I had a
Woohoo!
93-year-old lady yesterday who I was doing an epidural on, and she's a big pickleball player. And she was telling me she's 93 and she plays with 50-year-olds. That's
I
incredible.
love her already.
I have an 83-year-old guy that's a senior Olympian. He does the senior Olympics for track and he does sprinting. And he is somebody who's always in pain, but he knows that his age will mean he's always nursing injuries, but that I'm there to help him keep him running and keep him functional as best we can. So I'll walk you through a typical patient that I love seeing is that elderly or aging athlete, even somebody into their 40s that played maybe very competitively a sport in their 20s, but now still want to have that competitive drive.
I
fulfilled
love
in,
it.
but are suffering a little bit because their joints and their spine are not what they used to be. So, a lot of it is listening and educating and relating. Because I was once an athlete myself. I played Division I soccer in college, and I strive to be an athlete still in ways that my body can tolerate it, but it's different. It's different, and it's frustrating for patients to come to terms with the fact that they're not the same age as they were
Oh, yes.
15 years ago, and their bodies, even if they're mentally 20, their spine is their age. And we can't prevent some of the natural degenerative processes that happen. So a lot of it's just listening to that, educating them, and then really making sure our first line of treatment is always to make sure they're in really good quality physical therapy. So we also
Excellent.
educate patients to make sure that they know what that means, because a lot of the physical therapy groups have suffered the same thing that a lot of medical groups have. They're high volume and not a lot of attention per patient. So we really investigate what they've tried and what experience they've had and encourage them find a group that provides good quality PT. Now, beyond that, if they have an acute issue, often we see an acute disc injury or a flare up of a certain muscle spasm, then we offer different kind of treatments, whether that be injections, medications, education, and kind of the modalities they can do on their own at home, and imaging if warranted. We do a lot of MRIs here when we think there's disc issues going on in the spine if they've been suffering for a while. And going through the imaging with a patient and offering whatever treatments they may need. But we're a conservative practice, so we really encourage patients to participate in good quality physical therapy for those that are active and want to maintain good activity.
Well, that's such a good solid base. Movement is medicine. And so starting there, get the function, get the strength, make sure you're moving in the right position. Because even if you're going higher level advanced techniques, but they continue to re-injure it
Yep, yep.
without healing properly, it's probably not doing them a service.
It's the healing and it's the maintenance. I tell patients
Mm.
all the time, we can't reverse arthritis. We can't reverse the natural aging degenerative process, but what we can do is really nourish and support the structures with good mechanics and good strength and their appropriate muscles to help protect the spine, protect the joints from further, more aggressive degeneration processes. So if you're going to do, patients want to continue running, I have to encourage that they have like really good physical therapy to keep certain spine muscles strong, core strong, and have good posture mechanics for their long runs so that they're not further destroying or putting forces through certain elements of their spine. They're going to feel it when years to come.
Yeah. Yeah, we want to keep people moving and keep them moving in the right and safe way.
Exactly.
Okay, so say now somebody is doing that. They've got their movement mechanics right. It's part of their healing, it's part of their maintenance, and they're still struggling with pain. What's next?
So we usually offer different, depending on where we think the pathology is coming from. And in spine, it's usually generally one of two things. It's either their facet joints, which are the little joints that make up the whole spine and interact each vertebral body with the one above and below and allows our spine to be mobile, or it's a disc issue. And both of those things can contribute to stenosis, which we see as patients get a little older. So depending on where we think the majority of the source is coming from, we offer interventions. Sometimes it's injections, sometimes it's more advanced interventions, but in general, we try to categorize mild, moderate, severe. If patients have mild findings, we really encourage conservative care. If they have moderate to severe findings, we encourage considering interventions like injections to help control pain, continue their participation with therapies. If things look like
Yeah,
they're
because
moving,
it's not instead of therapy. You don't just get an
exactly.
injection like it's a magic wand and then go off. It's in addition to therapy, yes?
Exactly. Exactly. And that's the number one thing we have to explain to patients too, because everyone wants a quick fix.
Of course. Of
So,
course we do, right?
but it's the maintenance, it's the helping control pain and the maintenance of therapies beyond that. So patients sometimes don't like that answer. Some patients do. Some patients enjoy the idea of having conservative physical therapy on board as being their organic way of healing and maintaining good health. Whereas some people just want to have an injection and feel like they're young again. And I wish I could do that, but we're not quite there yet. That's where things like regenerative medicine are interesting topics because I don't think they're the magic button, but they are ways for patients that are in a certain category of age and activity level and pathology where they may be able to be more helpful than the standard steroid injection. But it's a little controversial and it deserves a whole nother podcast episode to have a discussion on. But it's
I would love to. I was going to say I want to hit on it here, but it's something I would love to dive into because it's exciting to know what the possibilities are. So you have injections. People commonly hear spine injections. They're thinking something like a steroid. So
Yeah.
you're injecting it. You mentioned epidural. Do you do facet joint injections?
Yep.
Just where the pain is where you would treat?
Yeah, and we base symptoms based on patient's presentation, but also compare that with their MRI findings, their
Mm.
imaging. It sometimes matches, sometimes doesn't, but then we talk about where we think the source of their symptoms are truly coming from, and then we probably do some diagnostic injections also if we're confused about the exact source. Like low back pain could be coming from a variety of places, the facet joints, the nerve roots, the muscles, side joints. So depending on if there's a debate of where the symptoms are coming from, sometimes we'll do diagnostic injections as well to help us, narrow down where the source of pain is.
Excellent. And I'd love to a quick sidebar into what you mentioned that the MRI findings don't always match the patient's symptoms. If you MRI a bunch of healthy people with no symptoms, you are going to see some disc problems and stuff. So I'd love for you to just maybe give us all a little education on function versus findings.
Sure. And that's why I'm a little weary and a little bit hesitant to encourage patients to get these preventative MRI body screens that you can pay
Yeah.
so much
Yes.
money for, because you're going to find things. And the fear is that you find things and it provokes anxiety and attention to body parts that we're just doing fine.
Right.
Like you said, patients can have findings on MRI and minimal symptoms, whereas some symptoms may be present and there's minimal findings on MRI. So that's where the physician, the art of the practice becomes where do you do with these? Do you treat things that are minimally symptomatic but have moderate findings on MRI? Probably not. But patients that are symptomatic that have minimal findings on MRI, it depends. It depends on if there's other factors that contribute to chronic pain, which we know definitely are, and it's stress, it's lifestyle, it's diet, it's a multitude of factors that contribute. This is where the art of the practice and the provider become very different and maybe opposed in different practices how to treat.
Yeah, no, and I think that's really important. Understanding the imaging is a data point and the symptoms are a different data point. And I love how you bring in that art. I would love to touch on what you just said. There are factors that contribute to chronic pain in addition to a physical abnormality. And that's a frustration I hear from a lot of patients in the ER is my doctor thinks I'm crazy. They think I'm imagining it just because my MRI doesn't look that bad. And I don't think that is what you or I are saying at all. It's
Yeah.
that those cause physiologic changes. Can you speak to that?
Sure. Like you said, MRI results are a tool.
Mhm.
It's not everything. It's not the Bible. I think a lot of
Right.
doctors get caught up sometimes. And surgeons tend to be like this a lot too, because if there's not a problem in MRI, they're not going to go and operate on you and fix it. And that's understandable because anything surgical comes with the risk of having complications. So it's got to be a risk benefit ratio. But then in a pain practice or even an ER practice, in terms of trying to understand what treatments to offer patients that don't have any or severely convincing findings on MRI, how do we go about treating this? It's complicated. There's a lot of
Yes.
factors that you have to address in patients' lifestyle, diet, and activity level, stress level, history of any kind of trauma, and any kind of contribution from like a psychosomatic place. I hate when patients say they were told they're crazy because there is a huge factor of chronic pain that is stored within like our central nervous system that may be related to history of deeper stuff that it's important to delve into for patients that are legitimate. It doesn't mean you're crazy, but it means that there's a major contribution from whatever maybe traumatic event or stress that you had been through that definitely is important to consider when treating your pain. Um,
Yes. Yeah, it's
so
not imagined. It's not, you're not crazy. It's the body stores stress. The issues are in the tissues. And then you've got a bit of a functional thing, those changes you mentioned as we age, and that can culminate in needing to see you.
exactly. And we try to address that too in patients and make sure that's normalized and heard because there is no chronic pain without a little form of anxiety or depression. And there is no depression or anxiety without a little form of chronic pain. They come hand in
Mm.
hand. And I think it's okay for patients to have the mental health aspect addressed in our office too, as long as they're getting appropriate care and they're okay with discussing it.
Yes. Oh my, if we could have billboards with just that, you don't have the physical without the mental and the mental without the physical because our brains are connected to the rest of our body. Weird.
Exactly. Yeah.
But how you are normalizing that is just can be life changing for people. They don't feel like they're being blown off. They're being seen as a whole person.
Yeah. And it's addressed with, and a lot of success in chronic pain is addressed with a comprehensive program. So we're not
Mm,
just doing the textbook physical treatments. If there is a room for, or if there is room for treatment of the mental health aspect or the central nervous system being a role, and we address it with certain medications, different type of like maybe biofeedback or mind body work suggestions for patients. So we see that patients that end up doing the best long term for some of the chronic pain issues have the open-mindedness of hearing all the aspects and avenues of treatment options.
nice. And I'm guessing that mind body component and the mindfulness and those practices are just as important as the physical therapy for that foundation and maintenance. So is that something you've found?
Yeah, not in, obviously not in every case, but in patients that have a little bit more of a complex chronic pain case.
Mm.
Yeah,
Yeah,
definitely.
no, that takes a toll on you. It causes anguish, and it's okay to acknowledge and treat that as well.
Yeah, agreed.
They don't have maybe as many fancy machines for it, but it's still nice. Okay, so let's get fancy. Let's talk about some of the newer options, the regenerative options that you're helping patients with, and what kind of results are you seeing?
So yeah, it really has to be an appropriate patient, understanding risk benefit and understanding why we're using regenerative medicine. And it's a broad, very broad topic that I can just speak briefly upon, but obviously it's deserving of a whole devoted talk for. But in general, it's the idea of using your own cells to help either heal or help initiate inflammatory response to help initiate healing or resetting of the inflammatory process. And that could be your blood cells or it could be your bone marrow cells. In our practice, we don't really use exogenous cells. So I don't buy stem cells or cells from a company that gets them from other humans or animals or other sources. We really only practice regenerative medicine from patient's own cells. So it would be platelet-rich plasma that comes from your own bloodstream or bone marrow aspirate cells that come from your own bone marrow. And there's a reason we do that. There's risk that comes with entering cells from another species into yours and whether or not that is A, safe and B, effective. The studies and evidence really support regenerative medicine and tendon issues, so tendinopathies, people with tennis elbow, gluteal tendinopathy, maybe patella tendinopathy, and there's just a lot of mixed evidence in its use in the spine. Now, we do it in the spine, and we'll explain obviously to patients the risk and benefit ratio, but I usually offer the standard of care first, which is the steroid or
Mm-hmm.
just the local anesthetic if we're just trying to get diagnostic value out of it, mostly because that's A, what's covered by insurance, so not everyone has a couple extra $1,000 to spare because these things get
Right?
priced, but also because it's important to practice what's been studied as safe and effective for many, many years. But I think there's a lot of room for its growth and understanding of where it can be utilized and maximized in patient care, where patients are looking to avoid excess steroid use because excess steroid can cause other side effects and
Yep.
uh, have concern of its own. And I think there's room for its growth. It's just a matter of understanding what patients are appropriate and how to utilize it and in what shape and form. That's my brief, broad discussion on it now. There's a lot, probably more detail to it, but it's
Yeah. No, we'll definitely need to dive back in. But I think you helped answer some of the controversies. So one, oh, and fear, controversy and fear. One, where are you getting it from? There's a lot of fear and controversy around that. Where are you obtaining stem cells and things like that? And then two, that you're applying it only in specific patients for specific reasons, as opposed to some of these stem cell mills, basically, that you can go in and if you say it hurts here or here, they'll inject it wherever
yeah, exactly.
without enough discrimination. And so by using it from the patient's own body and using it only when it's appropriate, that really does help calm the fears and get better outcomes, right?
I think so. I think like everything and medicine included, at least the way this country is set up, is that things can be marketed and used as like a
Oh,
business. And medicine doesn't fall short of that, which is sad in a way. You have to be careful because there's intentions of providers and products that are purely just to sell and make money off of. So
oh, yes.
it's important to keep a good academic helmet on with when offering things to patients and make sure they're really offering things that have legitimate evidence from respected journals. Um,
Yes.
and then
Yeah.
patients
Not,
are
not
aware.
the Journal of the Inquirer magazine.
Exactly, exactly. So it's a tough thing to navigate as a patient, because you can be fooled, you can be tricked or told or sold or not as well educated as maybe you should have been to make a decision. But it's an interesting space. So I think
It
there's
is.
for it.
My friend Joe Polish, who is the founder of Genius Network, taught me a term he heard called cruel optimism. And I feel like it preys on people and say, oh, if you come in and pay $20,000, the stem cell injection is going to magically fix your life. And that's unfair because it's unreasonable.
Well, also, pain patients are your most vulnerable patients. The pain
Yes.
patients with money, it's like you can obviously prey on people that are desperate to help. And if you tell them there's potential for help and you word it a certain way, anyone will pay anything for help. And it's sad. And that's where I have to warn my patients just to be careful out there because you're a vulnerable population.
Yes, and that's why we're bringing this to the listeners. They are in pain, they are frustrated, and they're looking for answers and want to avoid those kind of more predatory practices and really find people who can help them and get the relief they need.
Yeah.
So what like walking back through the journey, so they're in pain, they reach out to a specialist like you, and they're met with empathy and listening and looking at them as a whole person, both their emotional trauma, their physical symptoms, imaging, function, all of those things. And you give them the foundation of the physical movement and then offer additional interventions as appropriate for that specific patient. Did I do that right?
Yeah, that was said beautifully. Thank you.
Yeah.
That's like the summary of our practice here and what we try to really employ for every patient that we see that walks through the door.
Yes. And I love that. And I would love if you can also share with our listeners. So, say they're sitting at home in pain right now. Is there anything that they can do at home while they're waiting to get in to see a specialist or in between appointments that can just really help them with their pain? Any thoughts on that?
Yeah, it sounds like a general cliche practice, but the things that we can control on our own without the need of a provider, and the things that I'll reiterate if you see me or other providers maybe also reiterate if they see them, is the practice of the self-care, making sure as best you can to eat well, sleep well, have good support around you from whoever you can, and really understand that your suffering is real and to work on creating a team around you that addresses all the aspects of your care and know that it's not going to be a quick fix. It'll be a journey, but the best you can take care of yourself with the parts that you can control, with what you take in food wise, and if you can afford, just find ways to get good sleep habit and do mind body therapy. There's a lot of apps and resources out there, and not all of them are great, but finding maybe an app that you can at least have access to that you don't need to necessarily have a provider walk you through, do the meditation, the mind body stuff. And those are the things that you can do at home before if you have to wait to see a provider.
Yes. No, I love it. That's very empowering. So we know that there are so many levels of possibility for these people that are out there suffering.
Absolutely. And I think the number one thing we can do as providers is educate our patient in how to manage these things on their own so that you don't always need a doctor to tell you to take care of yourself. You have your list of 5 tools that you can do on your own, whether it be these certain stretches, these certain exercises, these meds that you have available to you, the techniques for mental health or mind body work or meditation, whatever that empower the patient to be able to take a little participation in their own self-care.
Yes. Oh my gosh. I love everything about this. I know that everybody wants to make an appointment at your office right now. Can you tell us where you're located and how patients can find you?
Sure. We're located in Marina Del Rey, and then we go down to Newport Beach once a week. So we're trying to serve 2 communities, but we're busy. But we like to see every patient that feels that they need help. So we have a website. It's my name, md.com. So Leia Rispoli, md.com.
And we'll pop that in the show notes too for people.
And our office is, you can call us and get somebody on the phone or leave a message. We get back to every patient within 24 hours. We are happy. We're in network with just about all the PPO, and we take Medicare. So we try to strive to see and not discriminate and be able to see as many patients as we can.
That is amazing. And so we'll love to have you back and dive deeper into the regenerative options because I know that's an exciting topic for people. But thank you. So you really gave us a framework, how pain can be addressed, that we are whole people, that the suffering is real, and that there are ways to help. So thank you so much, Dr. Leia Rispoli. You are truly amazing, and thank you for the work that you're doing out there and taking care of patients.
Thank you for having me and appreciate the time to be able to publicize some of this. It's great.
Yes, thank you. And I know you've got patients still on the appointment calendar for today. So
Yes,
thank you again for your time. We really appreciate you.
of course. Anytime. Thank you.
All right. That was an excellent episode with Dr. Leia Rispoli. Let's go through the takeaways and get you to your free gift. So, we have 7 quick takeaways here. Number 1, seeing the whole human being. She emphasizes the importance of viewing patients and for you as a patient to be viewed as a complete individual, not just as a set of symptoms. And for you, the takeaway is in any situation, you can approach people with empathy and a holistic view. Understand everyone has a unique story and set of circumstances that shapes their experiences and needs. Number 2 is self-care isn't selfish. Taking care of yourself is crucial, especially if you're a caregiver or if you're a patient, or if you're in pain. That's incredibly important. So your takeaway, prioritize your own well-being to be more effective in helping others. Remember, your health and happiness are important, and taking time for self-care enables you to better support those around you. Number 3, active listening skills. These are a fundamental part of Dr. Rispoli's practice and can be valuable in your everyday life. You can practice active listening skills by truly hearing and understanding what others are saying without immediately jumping to solutions. They say the expression is listen to understand rather than listening to respond. This fosters deeper connection and more meaningful interactions. Number 4 is there is no quick fix for pain. Managing pain requires a variety of personalized tools and approaches. Your takeaway is to understand that pain management is a journey. Be open to exploring different treatments such as medication, physical therapy, psychotherapy, and a variety of other modalities. Work with your healthcare provider to find the best combination specific for you. Number 5 is that mind-body connection. Psychotherapy and other mind-body practices are vital components of holistic pain management. Your takeaway is that this is an acknowledgement of the impact of mental health on physical pain. Nobody is suggesting you are crazy or faking, but really just validating the emotional toll that pain takes. Engaging in practices like meditation and psychotherapy to harness the power of that mind-body connection can really help with managing pain. Number 6, recognizing green flags and red flags in doctors. It is essential to find doctors who listen and provide personalized care while avoiding those with poor listening skills or unrealistic promises. So your takeaway in this instance is also the free gift for this episode. If you click on the link, you will get a checklist for green flags, things to look for that are positive in a doctor or a healthcare practitioner, and red flags, things that are worrisome that may guide you away from that physician or healthcare practitioner towards somebody else. You want to look for people who have your best interest at heart, and this takeaway will guide you on that process. And lastly, number 7, immediate steps for managing pain. If you are currently in pain, it's important to focus on yourself as a whole person. Prioritize nourishing food, restorative sleep, and mind-body practices. Utilize the available medications and modalities that you have now, and seek out a qualified expert for more advanced care. By integrating these principles into your life, you can enhance your well-being and effectively manage your pain. Remember, holistic care is about treating the whole person, not just the symptoms. If you enjoyed this episode and you want to explore more about Dr. Leia Rispoli's empathetic approach to pain management, you can check out her website at leiarispolimd.com, and stay tuned for more insights and practical advice on the next episode of Navigating Hope. Thank you for tuning into Navigating Hope with me, Dr. Jamie Hope. It has been an honor to navigate the realms of health and wellness with you today. Remember, in the journey toward a healthier life, knowledge is your compass. If you enjoyed our time together, please share, like, and subscribe to Navigating Hope. Join us next week where we'll continue to empower your health journey, arming you with the wisdom to navigate life's challenges and keep the emergency room in your rearview mirror.